What's up, Everything Medicare Podcast Nation? This is Christian Brindle here today, and this is episode 99. We're one episode away from 100 episodes, and we have you, the audience, to thank for that. And today, I'm really excited about this episode. It's one I've been looking forward to doing for some time. I have a really great guest here with me today. I have Tracy McManamon from the Your Medicare Benefits podcast. Tracy, like myself, is a podcast host. He's been doing it for a little while longer than me, helped a lot of people with it. And I'm just honored to have him on with us today. And we're going to have a great conversation about Medicare, maybe talk a little bit about the enrollment period coming up here pretty soon. Tracy, thanks for joining me.
Thanks, Christian. It's great to be on your podcast. I was looking forward to doing this. I've listened to yours. Had a lot of road trips lately, so I've had a lot of opportunity to listen to your podcast, and I think you're doing a great job and a great service to the public.
Hey, well, thanks, Tracy. I appreciate it, and you as well. You know, I like your style of condensing the information so that there's no fluff. I think a lot of people appreciate that. So, Tracy, let's jump right in. Talk a little bit about your story and how did you get into the Medicare industry? I know you've been in the business for 33 years now, which is insane to me. I mean, that's crazy, 3 decades of experience. So I just really want to pick your brain and give a tremendous amount of value to the audience. Talk about your story. How'd you get into the industry?
Well, it's funny you asked that. I didn't think you were going to ask that question, but I grew up in an insurance family. My father was an independent agent for 60 years. And I never wanted to do what my dad did because I saw how hard he worked. He was always on call 24 hours a day. But at the same time, I knew that my dad had great satisfaction from what he did. And so, I've been in professional sports. I've been in the advertising business. I've lived in different parts of the United States. And when I started this agency 33 years ago, I actually took a piece of paper and I wrote down 10 things that I thought I wanted to do. Buy a McDonald's franchise. I think everybody thinks about these kinds of things. Chick-fil-A didn't exist. Chick-fil-A didn't exist back then. I probably would have bought a Chick-fil-A right away. But Subway sandwiches, consulting agencies, what have you. And so the last thing on my list was an insurance agency, believe it or not. And so I said, okay, I prayed about it for a long time. And I jumped right in, and we were, thanks be to God, we were very successful right out of the gate. With that, I landed some huge accounts, and I've never looked back. Even after 33 years, Christian, I enjoy and I look forward every single day. I don't hit the snooze button. I can't wait to get going every day. Okay, the snooze button doesn't exist on my. And so I'm at the office extremely early. I'm here very late, like you, I'm sure. Especially right now, we're working at least 6 days a week. Mm-hmm. And just getting ready for the different things that we're going to be facing with open enrollment and things like that. But I love doing what I do. And, I heard one of your podcasts before about sharing commission income with what we make as agents. And I thought, wow, that's really unique because the public doesn't know that. Not every time, I'd say probably at least half of the times that I help someone with their Medicare benefits, they either ask me initially or they ask me at the end to say, okay, how much do we owe you? Mm-hmm. And so my response is, close your eyes. What do you see? Nothing. Well, that's what you owe me. But, I don't know, like you, what we get paid. And I don't get involved in a lot of these trips and all that kind of stuff. I do what's best for the consumer because I'm going to meet them at the grocery store or I'm going to see them walking down the street with my kids. And I have 5 children. I don't want us to have to run to the other side of the street to avoid somebody or not look at someone in the grocery store and say, hey, how's that going? How's your family? How's your kid? That's not who I am. And that's not how I built my firm. And so that's really what makes me, and that's really kind of what motivates me every single day.
Hey, well, I can appreciate that quite a bit. And, you and I are kindred spirits because I got into this business because my father before me, had been in the business for quite some time, late 80s, early 90s is when he got in himself, probably around the time you did. And And so I was in the same boat. You never thought you wanted to be an insurance agent.
Right.
Probably the bottom of the list. So
Yeah.
I can sympathize with that. And I can always appreciate an agent that the needs of their clients is what they're concerned with. And I think that's when you get the most reward out of it. I mean, this podcast that I've done, a lot of people in the industry look at me as a controversial person for the things I talk about on my podcast, and being willing to disclose commissions and stuff like that. People think I'm crazy for willing to do something like that. But I think people like you and I understand, because we're in the business of helping our clients and not necessarily ourselves.
Right.
Well, let me transition over to this, Tracy. Let's talk a little bit about your podcast. Talk about your approach when you're making an episode. How do you come up with topics?
Really, it's based on, and I'm sure much like yours, it's based on the questions that I get every day when I sit with the consumer to try to help them understand Medicare. Mm-hmm. And so I'm helping them with their Medicare. Then I go back to the office, or after the meeting is over, I then sit and think, wow, they didn't really understand Part D, or they don't understand this Part B deductible. How does that work? What all the mass confusion that's going on about Plan F, whether it's going away or whatever. As you know, all these, let's just call them knuckleheads that say, they're going to, Plan F is going to have 80% increases and all that kind of stuff.
Oh my goodness, yes.
There's just so much noise out there, and we're to blame. Our industry is to blame, and us agents are to blame, because can't really say, as you probably feel the same way, a lot of them aren't telling the truth. And
agreed.
That really fries me. And so my podcast, when I started this years ago, was really designed to address a single issue or two issues, if they're related, and just kind of sort it out. People don't want to know everything about Medicare, right? I've never had somebody sit down and say, okay, I have 3 hours now. Tell me all you know about Medicare after 33 years of being in the business. Never have that, never will. So they want to know what the fine points are, the important points, what's the exclusions, how does a supplement compare to an Advantage program? What's this open enrollment? I have a Medicare supplement now. Can I change it, without open enrollment? All that stuff. And there's just so much noise that I thought that I could just create these podcasts and then just address those issues. And in a very clear, I don't edit my podcast, by the way. You might hear me, stumble or whatever. It's just me. It's just me talking to them, to you. And that's how I like it. And that's really the way that I designed it. And it's so far, thanks be to God, it's going pretty well.
I can appreciate that. Because I've had a similar approach when we started doing ours. I wanted it to kind of just be, it started out with just basically me ranting and riffing, about a certain topic, and, didn't edit it, people, some of the gals in our office and people we work with were like, well, we should cut this part out. We should cut this part out. I'm like, nope, throw it up.
Right.
Throw it up. I'm like, I made a mistake, throw it up, because it's real. Right. So I can appreciate that. Let's talk about clients for a second, and kind of how you operate in your agency, Tracy. What is your approach when you're working with someone on Medicare? Let's say, hypothetically speaking, someone's aging in, and they don't know anything about Medicare. What is your approach as a broker when you're working with somebody as far as helping them through that process?
Well, I've written a lot of things as well, and there's a few things I tell them not to do. Okay, and I know you did the same thing. Number one, do not put your name on a website, your phone number on a website.
Mm-hmm. Agreed.
I can't tell you. I've been in people's houses, and I just, hear the phone ringing and hear the voicemail going on. And, this is so-and-so from ABC, NBC, whatever. And it's just ridiculous. So that's probably the first thing I tell people. Second thing I tell people is just bring in all of your brochures that you have. And you don't need to answer the phone, because I'm going to tell you all the things that the association plans talk about, the ones that are on TV about every 8 seconds throughout the day, right?
Yes, of course.
There's primarily two. And I tell them, don't call those people. You shouldn't just say, I want to call this particular insurance company because I saw their ad on TV, or I heard on the radio, or I got some of their material. So that's something else that I do, is to try to get them to steer clear, because usually when it's all said and done, I try to present 3 different options for a consumer, 3 different carriers. And I will say this, Christian, I stay very close to the name brand carriers, and you know who those are as well as I do.
And as do I.
In my county alone, there are 56 different insurance carriers, and I live in a very small, depressed county.
Yeah.
So it's ridiculous. And so, again, you and I go through the list and you say, oh, this particular company started 2 years ago and whatever. So, I steer clear of those. I stay with the majors. But most importantly, what I do is I find out what the consumer wants, what they know about Medicare, and what they need, and what they can afford. You ask the same questions as I do. Do you travel? How about your doctors? We got to check your doctors. We have to check your hospitals, because, again, the problem with some of the plans that, as I say to some people, you can have access to the doctor next door, but you may not have access to the doctor across the street, based on some of these plans that the way that they are. And so they don't hear that kind of stuff when they call the call centers, right?
No,
they
not at all.
Say, oh, ours is the best, and you can do this, this, and this, and we give you free this and free that. So the needs analysis, I guess, is really what I'm saying. That's really where we start. We find out what they want, what they know, what they need to know, and what they can afford. And then we build from there. And I present Medicare Advantage programs as well as supplement programs based on what that consumer is in their best interest. Not mine, but theirs.
I think that's a great approach, is showing them both sides of the coin.
Yeah.
I've always said that I thought that, if someone really understood well enough to make a decision, Medicare supplements on one side with a drug plan and Medicare Advantage on the other, if they really understood them well enough to know I'd like that one or the other one, I think that's 70% of the difficulty right there.
Right.
And I've never quite understood agents that go into a house, or they sit down with somebody that, they go into the meeting with the intention, I'm going to push this product. I don't care who it is I'm talking to. And I never understood that. That's just ludicrous to me.
Yeah. I ran into this just yesterday. A lady is turning 65. Unfortunately, she has end-stage renal disease. She's dealing with an agent who's only got 5 years experience. He didn't even know what end-stage renal disease really was, or what her options were. And I was totally flabbergasted by that. And we can, of course, talk about the carrier who, what he was doing. He had to go home. He had to go back home and research it. That was like 6 weeks ago. He still hasn't called because he didn't know what the answer was. But, you can't do that. You've got to operate on what the client needs and wants. And as you know, in some markets, the Advantage program is awesome.
Definitely.
Based on the market. I'm near a market in Pittsburgh, for example, where the Advantage program is probably 70% of the market share. There's the competition we have with the health plans and the networks. We have 2 major hospital systems fighting over each other, but and they both have health insurance, Medicare plans, and yet the Advantage program, because of the competition, is incredible. And the supplement programs are just not affordable. I mean, they're in the $300 range for a person turning 65 for, a plan G. And so it doesn't make a lot of sense in some cases based on the market when you have access to the quality healthcare that the Pittsburgh market has, for example, or the Cleveland market, for example.
Yeah. I mean, it's all market based, and I agree with you 100%. I've always used the example of my home market, Utah, and then probably my second market, which is Florida. Comparing the two, Utah's probably close to a 50-50 med sup, med advantage market, maybe more 60%, 40% advantage med sup. But if you compare it to a market like Florida, med sups are expensive, not as expensive as $300 a month, but pretty, probably $200 a month.
Yeah.
And the advantage plans are, they came from heaven.
Right.
And so it's all about market. I wish that was talked about more. I don't hear it talked about enough, I feel.
Really? Yeah. There's drawbacks to the Advantage program, as we both know. The networks are access to doctors and care, and having to get things pre-certified and all that kind of stuff. But for some people, it's okay. And
That's
so,
right.
you just have to find out. One thing I didn't mention, we have to talk a little bit about their health history. Are they high
Oh, yeah.
utilizers here? Oh yeah, I have cancer, or I go to the doctor every 6 months for whatever. And so, that's another very important dimension that we pursue and find out what their health status is. But it's market based. I agree completely, and of course, it's based on the individual.
Yep, absolutely.
What's up, everybody? This is actually Randy W. Hall, Mr. Nice Guy Medicare Advisor, not Christian Brindle, your esteemed host. I'm here to tell you about my Medicare agency, Mr. Nice Guy Medicare Advisor, based here in Tennessee. For the past 10 years, I've been helping Medicare beneficiaries just like you in Tennessee and Kentucky maximize their Medicare. If you're a regular listener of this podcast, you know Christian always encourages you to deal with a broker in your state who sells all the different plans and will give you not just a quote, but also advise you and educate you in a way that is simple to understand. We know how confusing and overwhelming the whole process can be. We do it all for folks on Medicare, from supplements to Advantage plans, Part D, cancer products, hospital indemnities, and more. So if you want to get a free quote or a consultation, I urge you to call 615-578-5174. Again, that's area code 615-578-5174. Or for more information, you can visit my website and read all about me at MrNiceGuyMedicareAdvisor.com. That's all one word, MrNiceGuyMedicareAdvisor.com. And again, why deal with a jerk when you can deal with a nice guy?
Well, Tracy, let's talk a little bit about the enrollment period for a second. We're just a little bit under a month away. So let's talk. So let's say there's somebody listening to this that, let's say, hypothetically speaking, they're in a state that neither of us are licensed in. And they're just confused about what they should do. If you had some generic advice for someone on Medicare as a whole that could possibly help them make a good decision during the enrollment period, what would you give someone like that?
Well, again, I tell them not to put their name on a phone number or on a website or their phone number on a website. But in my business, I always tell people that you want to have three things at this stage of your life, and I'm almost there myself, as you can tell. I'm pretty close to Medicare age. Three things that you want. You want a good accountant, you want a good attorney, and you want a great Medicare agent. And a great Medicare agent is not someone who just came into the business or whose uncle's brother, sister's mother is looking for business. I always say on my podcast in particular, 10 years or more. The agent must have 10 years or more experience in the business, because even this year to next year, the changes are huge, right?
Dramatically.
And just like this guy that was helping this lady that I talked to yesterday did not know what end-stage renal disease. Now, of course, that's in the test that we go through every year, as you know. Mm-hmm. What can you do for how to help someone like that? But this guy had no clue. And he had 5 years experience. That's what he said. But I always say contact an independent agent, not a captive agent. And by captive, I think we should explain that. Not someone who just works for XYZ insurance company. Mm-hmm. Someone who represents XYZ, but also ABC and the 1, 2, 3 and the one next door. Someone that is independent and 10 years, and do not put your name or phone number on a website.
Well, I think those are all really good tips. I think all of those, can be really helpful for someone on Medicare. And I'm sure, with your years of experience, I'm sure you've seen more agents than I can imagine come and go in the business.
Yeah. Well, that too. Yeah.
Yeah. And so, I think that's a really good catalyst. I've always told people, you probably, my time period has always been 5 years, but I think 5 to 10 years somewhere in there is probably a good margin. But there's so many agents, that have been in it 5 months that will say right. They've been in it 5 years, and that's the tricky part. Being able to determine who's authentic and who's not.
The other thing that I do, and I'm not sure if you do it or not, but I always tell people that I'm here now, next year, the year after, and the year after. I have a 12-year-old daughter at home. Okay, so I'm not going anywhere, even though I haven't been in this business for 33 years. I'm not going anywhere real fast. And I have another daughter that's 17, and I have 4 other daughters, none of which are married. So I only have one married daughter, and I have 4 more to go. So
big house.
you'll be retired by the time I get done with this. But, the whole process is extremely important, and having a good attorney, having a good CPA and a good insurance agent, because I give people my cell phone number. And I always tell, and you probably do the same thing, I guarantee that when you first turn age 65, the doctor or the hospital is going to screw up your first bill. I can almost guarantee it. And
absolutely,
probably 6 times out of 10, the doctor or the hospital does. They don't bill it the right way. They use the old information 9 times out of 10. So I give them my cell phone number. If you have a problem, text me a copy of it, or bring it in, or mail it to me, or fax it to me, whatever. But whenever you have a question about Medicare, call me, text me, call me, come in, whatever. Because chances are I already know the answer to your question, and I don't want to turn you over to an 800 number and say, oh, call the 800 number and go through this prompt. You and I have been through that.
Of course.
So all my clients have my cell phone number. And I get text, and that's fine. They're quick, easy, boom. And that, because healthcare, Medicare is important. And, they don't want to call a call center and talk to somebody in a warehouse in maybe the United States or maybe someplace else who, well, how do you spell Blue Cross Blue Shield? Whatever.
Yeah.
So,
being
in contact, it's a constant relationship that I have with my clients.
Yeah, I've always said the best ability is availability. And,
right. Like that. Can I use that?
Of course.
Okay.
Absolutely. I mean, we do the same thing here. Every single client of ours has my personal cell phone number. Text messages are such an efficient way to follow up with us. And, I think the access is so important to people, where so many agents and agencies, they're trying to find ways to cut the access off. Whereas, people like us, and that's the reason people like us stay around, I feel, we're happy to give the access. And I think that's always a good, important, very important factor.
Yeah, no, I think that's critical.
So Tracy, one last question I wanted to ask you, and then we'll wrap this thing up. And I've asked every single person that's come on this question. You may know where I'm going with this if you've listened to some of the episodes. It's a difficult question to answer. And like we kind of touched on it a little bit about, it's based on market, it's based on need. But if you had to pick one or the other, would you lean more towards the Medicare supplement side of the equation or the Medicare Advantage side of the equation as a whole? If you had to, for one reason or another, which way would you say that you lean?
Well, of the many clients that I've handled, I've never had anyone tell me that they wanted to switch their Medicare supplement plan or do something different. So to answer your question directly, probably at least 75% of my business is in the Medicare supplement field. Once they understand the benefit of a supplement, and they're significant over the Advantage program, if they can afford it, and if their needs dictate that, then that's what they end up doing. But the supplement just has so many more benefits than the Advantage. And I think that even with the expansion of some benefits to people next year that you and I both know about, it still doesn't warrant the restrictions that are still inherent within some of the programs. And access to doctors is becoming more and more important to people. And me too. My doctor just left a big hospital system, and now he's going to the other side of town, which is even farther away from me. I already go 45 miles to see him. In fact, I have an appointment at noon tomorrow. But now we'll have to go 60 miles one way just to see this guy because I like him. And so my health insurance, allows me to do that. But in the Medicare world, if I had an Advantage program, there is no way under the sun that I could have that access. And that to me is important. I have a long relationship with him. I have a couple of other dermatologist doctors that I like very much. My wife, of course, wants to keep her doctors, my children's pediatricians and things like that. Those are important. And access, availability, acceptance, not having to wait to get things approved. The new thing now, maybe I'm going too far with this, but an MRI. I just ran into this the other day. A guy had a bulging disc in his back. He's had it for years. He needs surgery. So what did the Advantage carrier say first? Because the doctor ordered an MRI. MRI got rejected. Go get an X-ray. Okay, so he goes to get a $50 X-ray, which then allows him to go get the $1,200 MRI, which then validates what the doctor/surgeon's concern was. So now the surgeon can do his job. But, there's so much of this protocol stuff that is inherent in the Advantage programs as well, that people, quite frankly, just don't like that. That's what I find in all the clients that I've helped throughout the years. But again, the Advantage program, it's got the Part D built in most cases, as you know. The dental, the vision, that's not really probably all that it's brought up to be. Some benefits are better than others. But the supplement, probably at least 75% or more of my business is the supplement, and the affordability of the supplement. I think people are scared that it's so expensive. And when I show them a Plan G, for example, and I'm here in Ohio, as you know, a Plan G, $102.
Whew. Well, that's a no-brainer in my opinion.
It's a name brand carrier, and everybody, I did 6 of them last night, as a matter of fact. I was at my computer, I was running rates on 6 different people, and every one of them came up with Plan G for 102. And
that's great. That's fantastic.
Yeah. So I really like the supplement. If it was for me, people ask me, what would you do? You're Christian, you got decades to go before you have to be in my shoes and be close to Medicare. But people always ask me, what would you do? Okay, I've explained the benefits, the pros and the cons. What would you do? And I tell them, for me, I'd get a supplement. I wish I could get Plan F, but I'm not going to get there fast enough.
Yeah,
I'm going to definitely take Plan G.
Next best thing, right?
Absolutely. Right.
Yeah,
absolutely.
Well, I appreciate this perspective, and I think there's a lot of merit there. I think there's just so much simplicity for people with the Medicare supplements. You don't have the first. You mentioned the hoops. You don't have the hoops to jump through. It's just easy. It's just easy for people. People like simplicity.
Right. Yeah, I have a guy that I was with the other day. He's 82 years old, and he has another plan. And I said to him, he's a wonderful man. I said, how would you like to never get a bill again the rest of your life? He said, really? Because I pay deductibles, I pay co-insurance. You mean I don't have to have another medical bill ever? Of course, as you know, because he's 82, he's eligible for Plan F. And I said, yes, both you and your wife, not going to get nickel and dimed anymore. He said, let's do it. So I'm going to see him Monday. Take care of he and his wife. She's 80 and he's 82.
Well, that's fantastic. That's great. Tracy, I wanted to finish this up I wanted you to talk a little bit about your podcast. If anyone was listening to this episode and they just kind of, they really, something you said maybe resonated with them, and they wanted to hear more of you and more of your perspective and more of your experience and expertise in the Medicare industry, where can they find the Your Medicare Benefits podcast? What platforms are you on? How can they find you? Talk about it for a second.
Yeah, thank you. It's called, the name of my podcast is called Your Medicare Benefits. We're on iTunes. We're on Google Play. Oh gosh, I can't think of all the different places we are. Stitcher. What are the other platforms? Blueberry.
Spotify. Are you on Spotify?
Yeah. And, we don't promote our podcasts. It just is organically grown throughout the years. But we're there. If people can't find it, they're welcome to call me. I'll be glad to, send them a link to my episode, whatever, just to make it easy. But and people always have access to me directly. I am not a call center. I say that I answer my own phones. I don't have 16 people to go through before you get to me. You call me, I answer the phone. That's the way it works here. But I'll be happy to send them a link to the podcast. But it's called Your Medicare Benefits, iTunes and Google Play. We're, pretty well spread out throughout those 2 platforms in particular.
Well, great. And if anyone's watching this on video on YouTube, I'll post a link in the description to Terry's podcast on Apple Podcast, and I'll also put Stitcher in there if you don't have an iPhone. Thank you so much for taking the time, Tracy. Thank you so much for coming on, and thanks for you sharing your expertise. And it's been a pleasure. This was a great conversation. Yeah,
we found each other by mistake.
That's right. That's right.
And so I'm going to have you on my podcast, and I want to hear your story. You've heard my story today and my approach and my philosophy, but you and I both know that there is just so much bad information out there. And I've listened to your podcast, and I know that, you and I are very much like-minded. And so I want to have you as a guest on my podcast and share, your story, your abilities, and, what you see the market doing, and, what's the trends, what's happening. Because I think a person that is dedicated like yourself and providing this type of service to the public really needs to get their story out, because the noise is incredible. It's just incredible. And it's inaccurate. Mm-hmm. And it's self-serving too. A lot of it's self-serving stuff, and I can't stand that. But you and I are very much like-minded. I didn't know that. I forgot, because I did listen to the one podcast where you talked about your dad.
Yes.
And
yeah.
So I did forget that, and I'm sorry, but I do remember you sharing that.
That's all right. That's all right. I've done so many episodes that it just kind of falls into a black hole sometimes. So it's not a problem. Well, yeah, I mean, when the time suits you and it suits me, let's set it up. It'd be a pleasure. I'd love to come on.
Okay. All right. Thanks so much for having me. I really appreciate it. God bless you.
Hey, the pleasure's all mine. Everybody, thanks so much for listening. Go subscribe to Tracy's podcast if you're not already. Listen to some of his episodes. I encourage you to do so on every platform that podcasts can be found. And we'll be bringing you a new episode next week. Thanks for listening.